from my experience, the most common causes of diarrhea are probably stress, diet change, and then in some cases, parasites coming into the shelter with animals that are coming in, puppies and kittens with heavy parasite loads. Those are probably the most common, and it makes sense. We're bringing animals into what can be a stressful situation. We're changing their food to whatever we're feeding, and then they may or may not already have predisposing conditions like parasites, Giardia, that can contribute to that. And so the majority of cases will resolve with food, particular food that helps with the diarrhea, with active deworming protocols, perhaps with nutraceuticals. I'm a big fan of nutraceuticals in the shelter. And then some time and some stress management. And so in assessing diarrhea, I think there's a couple of things we need to think about in a shelter. One, there need to be protocols in place so that even if a veterinarian is not in the shelter at a particular time, a staff member, a medical staff member, knows what to do. Whether it is collecting a fecal sample, whether it is moving that patient to an isolation ward and collecting other diagnostic samples, whether it is providing prophylactic care in the form of nutraceuticals or a diet change, there should be protocols in place. And that may mean defining the severity of the diarrhea as well. And so we need to help our shelters think proactively about managing diarrhea as soon as it is seen. And then assessing a response to treatment. And so most cases of diarrhea can be managed with relatively simple treatments. And then if an animal is not responding to that, we may need to explore further diagnostics to assess whether there is a more chronic or serious condition going on. Now keep in mind, some of our most serious diseases can start with diarrhea. So parvovirus, panleukopenia, these can start with diarrhea. And so it's really important that in patients who are high risk, our young animals, our puppies and kittens, our animals that perhaps just entered the shelter and have an unknown vaccination status, for those animals, they should be isolated and tested assertively to protect the rest of our population and to make sure that we're really doing the best possible thing for our patients. The good thing is that most diarrhea responds to some prophylactic treatments that are pretty basic. They're not treatable overnight, and so that's the thing I always need to remind my staff. It may take a few days of that prescription diet. It may take a few days of those nutraceuticals. It may take a few days of changing that animal's situation and putting them, in some place that is less stressful and helping them adjust to the shelter environment. And as long as we follow those steps, I think most diarrhea is treatable in the shelter. And then, of course, we do have the more infectious cases or more serious cases that will warrant more follow-up.